and today we're going to go over how to use an AED. So first off, what is an AED? It is an automatic external defibrillator. And so when would you use an AED? You'll use an AED when you find someone collapsed and unconscious, if they're not breathing or have abnormal breathing, if they can't find the pulse or they don't have a pulse, if their skin is abnormal color, and if they're not moving, and also if it's also on hand. So some precautions that you're going to look out for when you're using an AED is making sure that the AED is actually up to date, which isn't too hard. They have the pads and everything usually have like expiration dates or dates when they need to be looked at and make sure they're being used, and also the battery life. Gotta check on the battery life. Also, you gotta look out for if they have hair on their chest. You'll need to get rid of the hair, and it usually comes with a razor to do so, or you can always use the sticky part of the pad and rip it off. It's just to ensure that the pad has more like contact to the skin. Also, if the chest is wet, you need to remove any water, sweat, or anything. You also need to remove any metal that may be on the patient or yourself, just be on the safe side. And also if the patient has a pacemaker, depends, the AED might mess with that. So what are you going to look for when you're performing the actual AED? You're going to look for if the patient becomes conscious again. You're going to look at the skin color. You're going to make sure you're paying attention, because it will tell you to deliver shock or start CPR, and if you're not paying attention, that can harm the person. Also, you want to make sure you're not touching the patient when the heart rate's being analyzed, or if the shock's being delivered, or if anyone else is around, to make sure that doesn't happen, because that can put yourself in harm's way. So now we'll look at what the actual AED looks like. Some AEDs will come with this little package, and it will have like a razor, some extra pads, a CPR mask if you need to perform CPR. So what you'll first do is you'll open it up, and then it has instructions right here. It'll tell you to first turn it on, follow what the pads say, and then push the button if shock is needed. It'll have pads. There's different size pads. On the back it'll tell you there's for child's, large, whatever you need. So, and even on the pads it tells you what to do. Rip it open, get the pad off, tells you where to place it and to connect it. But you'll first make sure that the clothing has been removed, any hair or liquid has been removed. So then if you find someone, you'll first come over, turn on this button, then you'll get the pads out, follow the pad instructions, connect it into here, then it will analyze the heart rhythm, tell you what to do next, and if it says that the patient needs to be shocked, then this button will light up and you will hit the button. If not, it'll say no shock needed, and it might say start CPR, or it'll just say continue monitoring the patient. So now we'll move on to a scenario. So in the scenario, I have my patient who has fallen and she's unconscious. So the first thing that you're going to do is you're going to check the scene to make sure it's safe for you. So you'll look around, make sure, see if there's any wire, electricity around, or any traffic or whatever. Seems to be safe. I'll come up, try to wake her up. She's not waking up, and so I'll have someone go call 911. So I'll grab the AED since I have it on hand. And what I'll first do is I'll turn it on, and then I'll remove the clothing. And if she has any hair on her chest or any metal, or if her chest is wet, I'll remove all that. And then I'll open the pads, and I'll place one up here and one down here. I'll plug it into here. It'll tell me that it will analyze her heart rhythm. I'll make sure I'm not in the way. I'll make sure anyone else who's there isn't in the way. And I'll say stand clear. It'll analyze it, and if it needs shock, then it'll say shock is needed. Then I will make sure I'm not standing over the patient, no one else is. I'll say stand clear. Then I will deliver the shock. and it'll tell me once the shock has been delivered. And then if shock isn't needed, I might say start CPR, so then I'll start CPR. And then you keep doing it until either the AED says patient is stabilized, just keep monitoring her, or until EMS arrives. And that's it.